Welcome to another episode of Demystifying Medicine. Marijuana, also known as cannabis, ganja, weed, and pot, is an annual flowering plant. It is a psychoactive drug that can be used for recreational and medical purposes. There are over 500 chemicals in the marijuana plant, with the most commonly known ones being delta-9 tetrahydrocannabinol or THC and cannabinol or CBD. The legality of cannabis differs per country. Many countries have adopted decriminalization laws to make possessions easier, while other countries enforce stricter punishments. The countries that have legalized are Canada, Georgia, South Africa, Uruguay, and 11 of the United States. More areas have legalized the medical use. Even with the rise in acceptance and usage within the recent years, there are still many common misconceptions, with the two most well-known being that marijuana is a gateway drug and that it kills brain cells. In a 2017 study, it was found that 123 million Americans use marijuana, while 5.3 use heroin. Assuming that all heroin users were pot smokers, this would result in a value of 4.3%, showing a weak correlation, thus undefined, not biological, but more sociological. Furthermore, there is no evidence to support the claim that marijuana has neurotoxic effects. However, it has been shown to cause short-term memory loss similar to that of drinking alcohol. The studies in these regards have been inconclusive, with some showing detrimental effects, while others show protection against damages caused by Alzheimer's and Parkinson's. Medical marijuana is the use of the cannabis plant or its compounds to treat diseases and conditions. It has been shown to be effective in a host of illnesses, and in particular, chronic pain and fibromyalgia. The Center for Disease Control and Prevention found that 50 million Americans suffer from some form of chronic pain. This condition is characterized by pain that lasts 3 to 6 months or more and has effects on everyday life and mental health. A 2017 study in the Journal of Health Affairs found that the majority, or 62%, of medical marijuana usages are for chronic pain, and these conditions have substantial or conclusive evidence of cannabis being an effective treatment. Fibromyalgia is defined as widespread musculoskeletal pain accompanied by fatigue, insomnia, memory loss, and mood swings. In fibromyalgia, the brain intensifies the signals, resulting in a greater perception of pain. Although idiopathic in nature, it can be onset by genetics, infections, trauma, or stress, with symptoms increasing over time. Cannabis works through blocking spinal, peripheral, and gastrointestinal mechanisms that promote pain. In blocking these sensors, the perception of pain is decreased or halted. They use the underlying biological and physiological pathways to disrupt pain, relieving symptoms. Although most studies focus on marijuana and the effects of pain relief as a whole, there are a few that look specifically at fibromyalgia. In a 2011 study, it was found that 43% of patients reported strong pain relief, 43% mild pain relief, and the remaining 7% no changes. In a 2014 study by the National Pain Foundation, it was found that 62% reported cannabis as very effective, 33% as helpful, and 5% said it had absolutely no effects. A 2018 study published in the Lancet showed that cannabis was effective in both lowering pain levels and weaning off other medications. Another 2018 study published in the Journal of Clinical Rheumatology showed that cannabis had significant favorable outcomes in all tested categories. I wish I had received this treatment when I was first diagnosed. I returned to who I was before, and I regained my health are some of the testimonials. There are many other treatments that can be used in the case of chronic pain, among them non-steroidal anti-inflammatory drugs, opioids, epidural steroid injections, sympathetic blockers, over-the-counter prescriptions, and therapy. The other most used treatment method is opioids, which are a group of medications derived from the opium poppy. They're controversial, showing a variety of positive and negative effects. The positive effects of opioids are attributed to the euphoric feeling relieving the sensory and emotional aspects of pain. However, the negative effects of addiction, reinforcement, and dependency also persist. The The CDC in 2016 created 12 guidelines to make opioids safer. 3 notable recommendations are non-opioid therapy is preferred, clinicians should prescribe the lowest dosage, and status of the patient should be reevaluated every 3 months. In a 2018 study done by the Institut Universitaire de Charité de Montréal, it was found that it takes 1 week for someone to become addicted, resulting in over 3,900 deaths in 2017, which was 50% more than car accidents. Chronic pain is a difficult illness to treat as it affects each person differently. Please consult your medical professional before partaking in any treatment to ensure it is a good fit for you. Thank you.